Thousands of people in Massachusetts are bracing for a spike in the cost of health insurance following a cutback in federal subsidies ordered by President Trump. To tell us about the likely impact is our guest from Healthcare for All, the Associate Director of Policy and Government Relations, Suzanne Curry. Thank you very much for being with us, Suzanne.
Thanks for having me.
To start with, talk about the people who are directly affected by this. Who are they and what's it going to mean?
Sure, it's a little counterintuitive because we know that the Trump administration has eliminated payments for cost-sharing subsidies, but the people who do receive subsidies for premiums and cost-sharing through the Health Connector, which is our marketplace in Massachusetts, will largely be held harmless. It's actually the people who do not get help paying for their health insurance premiums or their cost sharing that will see the health insurance premium spike. So it's people who are buying particularly the silver tier plans on the Health Connector who may see an average of up to 26% increase in their premiums because of the elimination of these cost sharing subsidies.
Now, these are people who are not poor enough to really be subsidized, but I imagine there must have been some kind of advantage to buying insurance on an exchange like this, right?
Right. The advantage is you can see the different plans side by side. You can go through a streamlined process instead of having to call every health insurance company to find out what's available to you, and you can kind of really see, okay, what do these different plans cover? What providers do they cover? What are the cost sharing, like the deductibles and the copays and the different premiums, and really compare them side by side. So there is an advantage to having the Health Connector, even for people who don't access subsidies through it.
Well, when I see reports of something like a 26% increase in premiums, I mean, what are people going to do?
So there's a few things they can do, and the Health Connector has told us that they're going to be doing outreach to these folks who would be impacted. They can look for another plan on a different level or with a different carrier through the Health Connector and see if there's something that's cheaper that fits their budget that still offers them enough protection for the services that they need to get. Or they can look to work with their current health insurance carrier and see if they can buy a health insurance plan that's similar to the one they have now, but is not offered through the Health Connector. So they can go directly through the carriers as well.
I know there's still considerable flux about healthcare as far as what's coming out of Washington.
Yes.
But what about the signals? I mean, on the one hand, he seems to be saying, we're not going to enforce the mandate for people to have coverage, so maybe they don't need to get coverage, at least as far as government penalizing them. What about that?
Right. Well, it's definitely a big step backwards across the country. One of the unique things we have in Massachusetts is we actually still have retained our state individual mandate. So even if the federal mandate is eliminated, we still have a mandate in Massachusetts that residents who are adults need to purchase coverage if it's affordable to them.
Another thing coming out of Washington is let's have the insurance companies do business across state lines. And well, what could that mean?
Well, we're really worried about this. Well, first of all, this is not going to happen right away. It needs to go through a regulatory process that could take several months. So we don't know what the impact is yet because we don't know how the regulations will be written. However, we do have some concerns because we have pretty strong consumer protections in the state of Massachusetts. And being able to purchase coverage across state lines or sell coverage across state lines, a lot of insurance companies might want to use rules in this in a state that might not have as many consumer protections or ability of consumers to appeal to their health insurance companies.
This has been the news, and we're talking with Suzanne Curry from Healthcare for All. Suzanne, I know these cutbacks that you're concerned about right now are only in part of the market, but I still wonder here, if people are going to be tight for money and when they're looking at these different options, some things are probably going to be cut out. I mean, they're going to have to make some tough decisions, let's say about either mental health or substance abuse needs. What about that?
Yeah, I mean, we're really concerned about the ability of people to continue to afford coverage and to get the services that they need. So what I would say at this point, if you do receive your health coverage through the Health Connector or through the individual market, you don't receive it through your employer, open enrollment starts November 1st, and there are health insurance enrollment assisters across the state that can help walk you through your options to see what your affordable options can be. We've had a very good commitment in the state to maintaining benefits such as mental health and substance use benefits, so we're hoping that commitment will be maintained in the coming months as we see how things roll out on the federal level.
When you look at this part of the market being squeezed, what about the rest of the market? Because if we have some other needs and they're not covered through conventional insurance, then somebody's going to pick up the tab some way, don't they?
Yeah, I mean, I think basically it could go to bad debt for hospitals or other places that provide the services. There could be potentially wraparound coverage provided by public health insurance, like Mass Health, which is already provided as secondary coverage for some people. We're going to really have to see how this rolls out. But again, we're hoping that with the commitment that we have in the state, that people will be able to retain coverage that meets their budget and their needs.
Of course, the other thing is about incentives for preventative care. Do you see those threatened in any way?
Well, there's a lot going on the federal level, and I think a lot is being threatened. So we're going to have to see how everything shakes out. But yes, I mean, being able to have no-cost preventive services, which is one of the benefits of the Affordable Care Act, having your annual wellness checkup, making sure that you're on track with dealing with chronic diseases such as even mental health or diabetes or things like that, is very much something that's a benefit from the Affordable Care Act and a benefit from the strides that we've made in the state. And we do see them threatened. It's still a little uncertain how they would be threatened and how the state would react.
Thank you very much for being with us.
Thank you.
Suzanne
Appreciate
Curry
it.
from Healthcare for All. In a moment, we'll tell you about a new program for solving 2 housing problems for the elderly homeowners and graduate students. But first, this message.